The most important topic right now with the world media is coronavirus. And it's been discussed everywhere and everybody's talking about it. But most people don't know is what is the origin of this virus and how it all started. And most importantly, how can you keep yourself and your family safe from this? Now this video is going to be very interesting because I'll be sharing some very vital information and some really interesting facts. So keep watching the video and we will be right back. What's up my people, this is Imtiaz from FiTBash. Hope you and me, we all are doing absolutely fine. So now let's get started straight with the topic. What is coronavirus? So it's a member of a coronavirus family, and the way it originated was from a city of Wuhan, which is in central part of China. And in fact it came from one of the seafood market, which is called Hunan seafood market. Now how it came is, we all know that it started from consumption of bats, but it's not actually true. The way it started was the meat of bats, or this half live half dead bats was kept with other meat of other animals which were half dead, kind of. It's because it's a seafood market, so there are other meats as well. Because all of these were kept together, it actually got transferred from this meat to the people who are consuming this meat. So it actually transferred from the animals to the human body. And the first originally people who got affected was either the people who are working in this market or the people who are regularly consuming this meat or regularly visiting this market. So these are the people who were actually and originally affected. Now the way it's the symptoms are, initially you get cough and cold and fever, and people breathe really heavily. Now when this thing happened, we can actually take antibiotics and it helps, because antibiotics does help in fever. But this is such a deadly virus, and bats are actually known to carry the most amount of disease and most amount of viruses. So because it is transferred now in human body, these symptoms are slowly converting in pneumonia, and it ends up that the organs of the body, they are slowly dying, and the organs of the body are slowly stops working, and it ends up as a casualty or death. So that is the symptoms, and this is how it's starting. Now obviously the most amount of casualty is in China, but globally there are 80,000 people affected, and alone in China there are 2,663 people affected just in China. Other countries in Southeast Asia are Taiwan, Japan, Hong Kong, Vietnam, even Thailand is affected really badly. This is Southeast Asia. In Middle East, two countries which are really affected is Iran, and recently there are some casualties found in Kuwait as well. So in Europe, the most affected country is Italy, and especially even in Italy, the northern Italy is affected more. There are almost till date there are 14 casualties in Italy. Other countries are France. There are some cases found as well. Some in Spain as well, and in UK there are a few cases found, especially people who are affected in UK. When there are 4 casualties so far till date. That was the number given in Guardian or in BBC. So these are some important facts, and these are some important reason and symptoms how it actually started. So now let's talk about how are people reacting to this coronavirus in UK. Now I mostly see in tube people are wearing those masks. Some people are wearing those normal cloth masks, and I've also seen people wearing that N95 mask, which is like, you know, the one with those nostril things where you can breathe in and breathe out. So that's something within tube. In fact, even I have seen some of the people wearing disposable gloves in their hands so that they don't have to touch anything, or they don't get a physical touch of things in the tube. Now some people are taking really extreme measures. Like I was reading in the news that one person was saying that he started stockpiling up food, and he's collecting all the canned food and dried food, so that if something goes wrong and there is a shortage in supermarket, he can actually survive with his family for at least 2 to 3 weeks. So that's an extreme measure. More than that, one of the news said that one of the ladies, she has got so conscious about this thing and so worried that she's actually kept her children away from going out. So she's not letting them going out in the public or playing outside, or even not letting her go and meet their friends. Some of the people also have cancelled coming to London because they believe that London is obviously it's a multicultural place, and there are people from all over the world. So that's a highly risky area where you can get more contagious. But actually, life in London is absolutely normal. People are still going to work. Well, some people are bit worried, so they have started working from home. They don't actually go to office, but that's still okay. Life is still going. Life is still going on. Yes, the smart thing is when people have actually cancelled their trip to Southeast Asia, which is obviously very advisable. That if you have any trip, then you should be cancelling it. It's not advisable at all right now to fly or travel any part of Southeast Asia. Even people have cancelled their trips to Italy or Spain or even France, because even that is little bit affecting. So these are the measures people are already taking, which is fair enough. Obviously, everyone love their family, their loved ones, and they want to keep themselves and their family safe. So whatever helps and whatever is important, what they think is good to do, and people are taking the measures and people are taking precautions as much as possible. So now let's understand what is UK government doing and what sort of precautions and measures they are taking to keep the people in the country safe and to educate them. So their most focus is to rapidly identify the people who are suffering from this disease and taking them into the specialist care hospital and treating them in isolation. Then they're also trying to find out if they have came into close contact with some other people. So even so the government can take those people as well in their special treatment and make them aware about the symptoms and check them if they are suffering or if they have any sort of virus infected within their body. So these are a couple of things which they are rapidly doing and instantly doing with all the people and all the patients who are suffering from this. There are also some specialist care unit hospitals which are only being there for treating the coronavirus and the people affected. There are some ambulances with the specialist unit. Also, they have the laboratories where they are which allows them to treat or test over 1,000 people a day, so that they can rapidly find and treat those people. And also government is trying to educate people as with various different sources possible, like media and news and radio. Even they are advising the companies now to circulate notices and circulate emails. So many of the companies are sending emails and giving all the latest information and even advising them if they can travel to Italy and letting them know that these are the countries affected. People who are coming in from this country, especially from Southeast Asia or Middle East or Europe, which the countries which are affected, they are kept in quarantine for 14 days, where it's not a kind of house arrest, but they're advised to stay in house so that they can, if by any chance they have any sort of virus infected, they can get treated. And also if they have any sort of fever or anything, they can be treated before they can obviously start coming to work and start using the public transport. So these are some of the very important measures, and very obviously it's very important. It's good as well that government is taking it very seriously. It's a very serious issue, so government has taken it very serious, and lots of measures and lots of precautions are being going around, and lots of things are happening around within the country. And obviously the UK government is taking a lot of care of all the people around within using the NHS and various other hospitals and various other specialized units. So now we have actually understood what the virus is, how it originated, how are people reacting, and also what is government doing. But this is all done by government. What are we doing, and how can we keep ourselves and our family safe? So bear in mind that when you are going to public transport, do try and wear a mask, which is obviously very important and which will help you avoiding any such situation. If you can, also wear disposable gloves. I have seen many people wearing in the tube, and there is no absolutely shame in that. Do use hand sanitizers every now and then, especially when you are coming back from public place. When you are entering into your house, try and sanitize your hand. Use as much as possible. When you have any smallest symptom of cough or cold, or if you have a slightest fever, don't ignore it. Don't just take it lightly that that's fine. I'll just take antibiotic and it will go. Please don't. Try and contact your GP. Try and contact your doctor as soon as possible. Go there, speak to them, read the symptoms as well, and try and understand what exactly is the case. Obviously you are not a specialist, so the best possible option is you go and see your doctor. And if you have any plans to go Southeast Asia, try and avoid those trips. I know, I mean, obviously if you have planned, it's very difficult to cancel, but it's very advisable to cancel those trips and if being a Southeast Asia, if you're on that part of the world, if you're in the western part of the world, if you're traveling somewhere in Italy or in Spain or in France, try and cancel, if possible, cancel those trips. At least avoid those trips, because obviously that's going to keep you and your family safe, and that is the most important thing in this situation. So guys, thank you very much for watching the video. If you like the content, please hit the like button and please subscribe to the channel. आज के लिए बस इतना ही. Now I'm gonna see you back in my next video. Till that time, keep rising, keep shining. This is Imtiaz from FiTBash, signing out.